Hello, this is our lecture number 37 now. We're still in the area of therapy and different forms of therapy, and we're going to be taking a look at some of the behavioral approaches. But first, let's understand basically what we mean by behavior therapy. When we say that uh, from this particular viewpoint that behavior, disordered behavior, is really due as a consequence of inappropriate learning. Any behavior that's self-destructive, that it's unhealthy to the individual. The thought is it's really due to the fact that the individual just hasn't learned certain strategies in life in order to be able to cope with this. So when we take a look then at the keys to behavior therapy, then we're really talking about a person being exposed to unhealthy living conditions. You know, it's not about our biology. It's not about character defects. You know, it's not about mental weakness. It's not about unconscious conflicts that are going on within the individual. It's really about unhealthy living conditions that a person is in, that society has really failed to teach those individuals healthy behaviors. So the thought then is that we need to change the social environment, put a person into what we call a different milieu, a different social situation. We want to help them to learn better strategies, better habits in terms of their adjustment. And again, it's like being in an encounter group, but 24 hours a day, okay, non-stop. And what we were trying to do is to bring the individual into normal relationships, build up their confidence, build up their social competence. So again, this is a very different approach to trying to rectify behavioral problems. It is an approach that, even though it may appear to be you know, very automatized in some cases and dehumanizing in some cases, it really does work. And we'll see how it works in just moments. So let's start out then with you know, some of these therapies. This is one that's very common for trying to diminish drinking of alcohol in individuals that have an abuse problem. And it's really based upon the very simple principles of conditioned taste aversion. Take a look at this sequence of pictures that you see here. You know, if we had a particular substance that was mildly nauseating to the individual, and the individual was exposed to that, drank some of it, and it produced nausea. So again, that drug, that nausea-producing drug, is the unconditioned stimulus, and the unconditioned response is the nausea that's created in the individual. During conditioning, what we would do is we would take some of that drug and place it into a drink. Let's say this individual is really prefers wine. They drink a lot of wine, and we'd put some of that illness-producing drug in the drink. So when the individual drinks it, and again, they have the taste of the alcohol, in this case, the wine, it's associated with the nausea. So again, this neutral, this drug is combined with this neutral stimulus, you know, the alcoholic drink. And in the future, now that alcoholic drink, sometimes just the smell of it is enough to produce the nausea. So again, this is called aversion therapy for drinking. And I don't want to make off like this is a therapy that is super successful, but with some individuals it does work, and it does help to reduce their drinking. Another therapy, one that we already have some background in, is this the whole area of systematic desensitization. And again, this is in the treatment of phobias. You know, if we had a person, for example, that was afraid of driving their car at night on a real busy road, and again, this is a very rainy night, and that's the most feared situation for that individual as a driver. Well, what we would do is we would engage that individual in this relaxation therapy and begin by just having the individual sit behind the wheel of a car that's not moving and have them sit in their driveway. You know, we would move in a stepwise fashion then up this hierarchy of fears, you know, that we discussed in some of our previous classes. Now we move along to driving along an empty, quiet street on a sunny day. And again, we're doing this while simultaneously engaging the individual in relaxation therapy. So again, what we're doing is we're going to be substituting substituting relaxation for this fear that the individual experiences. Then the next most feared situation would be driving along a busy street on a sunny day. And then driving on the same street in the rain. Again, what we're doing is, you know, we're still engaging the individual in relaxation training, and we don't move up the hierarchy of these fears unless the individual is completely relaxed. Then we have driving on the same street at night, then driving on a busy expressway in the daytime. And then ultimately the most feared situation, driving on a busy expressway on a rainy night. So again, you're substituting one thing for another. You're substituting relaxation for this anxiety and fear that an individual is experiencing being in this situation of driving on a busy expressway on a rainy night. So again, this is how it is done. Another very popular therapeutic approach is that of token economies, and it's really based upon Skinnerian operant conditioning principles. This therapy is used in a variety of different contexts, but it really grew out of the observation of this dependency that's created in many large psychiatric institutions, because patients are given everything that they need, and what happens is they develop what is referred to as institutional neurosis, or they stop caring. They're given everything that they need, and they just are not engaged at all in terms of getting better. And token economies can really reverse all of that. Excuse me. So the goal then is to encourage responsibility. And staff members in these institutional settings reinforce behaviors that are healthy behaviors, behaviors that are socially approved, and they ignore inappropriate or abnormal behaviors. And here's how they do it. They will use what looks like poker chips that are of different colors. And whenever they see someone doing something positive, they'll get one of these chips, one of these tokens. And what happens is at the end of the week, they can redeem these for food items, for access, let's say, to playrooms, for access maybe to televisions or using computers. So they have value. And what happens is these behaviors that are being encouraged by this reinforcement, they tend to increase in their likelihood. And because inappropriate behaviors are being ignored, they tend to go away. So again, these token economies work incredibly good in a variety of different circumstances. And indeed, here's one. This is a token economy in the detention center for incorrigible juveniles. And what you see here in this figure is, you know, the basics of this situation consist of the following. we're going to give these tokens to these individuals when their behaviors are positive, healthy behaviors. This is what happens. You see, many more of these behaviors being exhibited, as you see here. But now what we're going to do is we're going to make the reinforcement not contingent upon performance, meaning that it's just the reinforcement is just going to be given out randomly. And what happens, those number of positive behaviors go down. But then when we make the reinforcement contingent again upon these good behaviors, these healthy behaviors, instead of it being random, again, you have an increase that occurs in terms of these positive behaviors. So indeed, again, token economy is used in a lot of different situations. It's used with children. It's used in psychiatric facilities with individuals that are, severely impaired in terms of particular behavior disorders to mild impairment. Here's a great example of this whole technique of behavior modification and token economies. If you take a look at language development in autistic children, it's very difficult to teach them language. You have to start out at a very simplistic level. What this figure shows is this. There's 3 words here that we're going to try and teach this individual. Please, thank you, and you're welcome. And prior to the time that any reinforcement is given, you see a very low level of them saying please, of them saying thank you, of them saying you're welcome. But what we're going to do is we're going to reinforce these individuals for saying the word please. And again, the reinforcement here, it begins. And you can see that this behavior begins to be strengthened and increase in its likelihood, that is saying the word please. You see it in terms of the word thank you. When you start out, when the reinforcement is not evident, again, the reinforcer that you use might, for example, be some food that the individual really likes. And what you can see is once that's introduced, again, once the individuals start saying thank you, you start to see increases in that behavior that has been, that language that has been reinforced with that food, for example. Take a look at you're welcome that you see right here. You can see that it exists at a relatively low level, but now when we start to reinforce that individual for saying those 2 words, you're welcome, then it dramatically increases. So again, this is what we call behavior modification, which essentially is token economies are helping autistic children to learn language. Here's another example of this. Many of you probably remember a period of time when maybe you're in elementary school, middle school, where these individual behavior plans called IBPs were drawn up for certain kids in school. Maybe they were ADD kids, maybe they were kids that had some learning disabilities. But in the token economy, you start out with a child that has no tokens, no access really to desirable things that they want to play with, for example. But then once the child begins engaging in some desirable behaviors, again, we call these target behaviors, we're going to start giving them some reinforcement. And what is very frequently used in elementary school settings are these stickers. That kids really love. So when a child engages in this good, desirable, positive behavior, then they're going to get one of these stickers. And again, they're being given these tokens for engaging in those target, positive behaviors. And then, let's say at the end of the week, the child can trade in their tokens for access to desirable activities, to again, ranging to, some additional food that they can get, snacks and so on, or access to television, or access to a game room, for example. Again, these individual behavior plans are drawn up all the time for kids, young kids in school settings, in order to change their behavior. So again, very powerful, used in a lot of different contexts. So token economies work with a few exceptions. And again, it works with a wide array of different behavior disorders, from things that are relatively mild to those that are relatively severe, and all different ages of patients it works with. It's probably, if you take a look at all the various therapies that are used, it's probably the single most effective therapy in terms of producing pretty reliable and stable behavior change. So that brings us to a close then, in terms of this whole area of behavior disorder treatments. And we'll be continuing our analysis in terms of the field of health psychology in our next lecture.